Now to our feature story, and a growing number of parents are taking their kids to see chiropractors, hoping to treat anything from asthma to bedwetting. But is it safe and does it work? And a warning that there is some neck cracking in this story, and frankly, it's a bit full on.
I'd take Ava to see a chiropractor for pretty much anything.
Jade's daughter Ava is constipated, so she's having a chiropractic treatment to fix it.
The whole premise of chiropractic is that the body has an inbuilt ability to heal itself.
The simple truth of what chiropractors do is they restore normal function to the spine.
And chiropractors say even a baby's spine can need correction.
By the time the baby's born, it's been through a bit. You know, it's gone through that traumatic process of delivery.
But if you're imagining cracked backs and twisted necks, then think again.
It's been described as about the amount of pressure that you could put on your own eyeball. It's not twisting or pulling or anything like that.
Some chiros claim the flow-on effects from that little correction can fix anything from asthma to autism, bedwetting to colic.
You could probably tell me any symptom and I'd be able to think of a case where the body's been able to heal itself of that symptom after they've had an adjustment.
But since conditions like autism are said to be incurable, the Chiropractic Association chooses its words carefully.
Chiropractors don't treat people with autism, they don't treat people for autism, but they'll treat patients who have autism, but they're not in any way representing that they can cure those things.
But according to Professor John Dwyer, while there is evidence that chiropractic can fix spinal problems, the idea they can treat asthma or bedwetting is
pseudoscience. There's absolutely no evidence, nor in fact could there be any evidence to support these pre-scientific theories.
There's lots of other clinical experience, and I'm differentiating from capital E published evidence.
You know, I could get a billion parents that would come here and say, look, we got up every single night and changed my kid's flooded bed until they got an adjustment.
But patient case studies are not the same thing as rock-solid published evidence, and there's not a lot of that to be found.
There's a reason for that. The chiropractors, because they don't prescribe drugs, don't get funding from drug companies, which is where most medical research is driven.
You have to draw the line somewhere, and when something is so ridiculous, so anti-scientific, it really doesn't warrant further research because the basic principle is clearly wrong.
But even for adults, spinal manipulation does have risks. 4 years ago, Lucy Snape saw a chiro for a checkup.
He held my head in both hands, he tilted my chin and then clicked left and then clicked right. And I remember distinctly feeling like it was an incredibly aggressive movement. And then he just said, look, go home and rest, it's normal.
But it wasn't normal. Lucy's vertebral artery was dissected by the force.
For anybody that's ever experienced nerve pain, it's searing and it is never ending. And that burning, searing feeling is very, very difficult to manage.
After 3 years of recovery and $30,000 in medical bills, Lucy says she's lucky.
The worst case scenario would have been that I had a fully blown stroke at 30 years old.
Cases like Lucy's don't happen often. The chance is somewhere between 1 in 200,000 and 1 in a million. While there are very few reported cases of children being harmed, the most severe cases globally have ended in death.
There's no place for chiropractic in the treatment of children. Because there's absolutely no chance of benefit, even the small risk is unacceptable.
The AMA is the peak body for doctors. It says parents' first port of call should always be their GP.
There is very little evidence that chiropractic treatment does anything for things like colic or bedwetting, and in particular, asthma is something that can be a lethal condition. You need medical advice for that.
It's simply a tired old turf war, and it belongs in the 1950s.
Back at Ian's practice, Mum Jade says she has all the evidence she needs. Ava's constipation has begun to clear up.
I don't want to put my daughter on medication if I don't have to. If she can be fixed at a chiropractor and in a more natural environment, then of course I'm going to bring her here. She's 10 months old.
I personally don't think that the benefit outweighs the risk, and I can't understand why you would ever want to put yourself in that situation.
Now, we've had so much feedback on this this topic today. It's certainly an issue that gets people going. Lots of people, one lady said, my son was very unsettled. We took him to the car at age 9 weeks old. We saw an instant change in him. Whereas Kat says kids' chiropractors is insanity. Sort of poles apart people in
But isn't this a bit like the vaccination debate? The same people who say go to the chiropractor, there's people who say don't vaccinate your children.
Not necessarily.
That woman complaints now from both of those groups.
That woman there who had a constipated baby says she doesn't want the baby on medication. Well, you don't have them on medication or at the chiropractor at that age to fix constipation.
Well, if chiropractors could just focus on your back. I went to a chiropractor once and he helped fix my leg and I was happy with that, but then he wanted me to keep coming back, and then once I actually had an appointment, due, I rang up and told the receptionist I had gastro. She said, don't come in, and then she rang back 5 minutes later and said, come in, he's going to fix it for you.
And so how did he fix it?
Well, he gave me some herbs to hold. It was getting weird, to be honest.
Did it work?
Well, I eventually got over. I don't know what fixed it.
That's Dave's scientific research. Hold a handful of herbs and call us in the morning if dysentery persists.